Ready?
Mm-hmm.
All right. Hi, my name is Savannah. I'm a Murray State CRNA student. I'm here to do an integrated exam today on you. And what is your name?
Scott.
Okay. Scott, before we begin, because it's a lengthy exam, do you need to go to the bathroom or anything?
No, I'm good.
Okay, perfect. General survey of the patient. Patient is sitting upright, well groomed, neat. Patient is calm and relaxed. I did see patient ambulate into the room. Patient did ambulate with a steady and balanced gait. Next thing I'm going to assess is your mental status. Can you tell me your name?
Scott.
Birthday?
11/1/87.
What year is it?
2025.
And where are you at right now?
Home.
Perfect. Patient is alert, oriented, speech is clear and concise. And then I'm just going to ask a judgment question. If you were to see a house on fire, what would you do?
Call 911.
Perfect. Judgment is intact. Next thing I'm going to do is get your vitals. We'll start with your temp. Okay, I'm going to temp. Okay, temp is 97.9. Next thing I'm going to do is get your blood pressure. Do you have a preference of an arm?
No.
Okay. Equipment's getting tangled. Sorry, my hands are cold. Okay.
It's okay.
I just want you to relax the arm right there. Perfect. And feet are uncrossed, hands to your side. Sorry, my equipment's, there we go. Okay, perfect. 120/78. The next thing I'm going to do is I'm just going to palpate your pulses, and I just need to do that on a timer. If you can hold your wrists out. Okay.
Both or one?
Both are fine, and relax. Okay, perfect. Heart rate is 80. And we get my timer reset again. I'm going to check your respirations. Just relax. I'm just going to watch you breathe. Okay, perfect. Respirations are 14. All right, awesome. Next thing I'm going to do is move on to the next part of the exam. I'm just going to look at your head. So I'm just going to touch and feel for any masses and deformities. No masses, deformities felt, hair distributed throughout. Head is symmetrical, rounded contour. There is facial hair present. I believe that is it. Skull did not have any masses or lesions. Next thing we're going to go to is your eyes. I'm going to start with this and check your vision. You do have corrected lenses on, so I'm going to hold this about a foot away from your face, and I want you to read this line right here for me, the very bottom.
LTFPH.
Perfect. That was with both eyes. Now can you cover your left eye and do it again?
LTFPH.
Okay, uncover that eye and cover the other. And one more time.
LTFPH.
Perfect. Vision is 20/20. I'm just going to inspect your eyes. You mind taking your glasses off for just a second? Okay, close your eyes for me. Let's cover eyes appropriately. You can open. There is lashes evenly distributed throughout. Sclera is white. I'm just going to pull down on your eyes. Conjunctiva is pink. I'm going to pull up. Pink and moist. Eyes are equal. Next thing I'm going to do, my ophthalmoscope. Okay, I'm just going to shine a light in your eyes to check your reflexes. Sorry, look at me. Perfect. Perfect. Pupils are a 3 and they react to light. I want you to look at my finger. Now look at the wall and look back. Perfect. And my finger and look at the wall and look back. Perfect. Pupils react, or pupils accommodate. The next thing I want to do is I want to check your red light reflex. So I'm just going to shine this light in your eyes again. Okay. 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 Red light reflex is present in both eyes. The next thing that I want to do is, I did your vision. Sorry, I have to think that through. Oh yeah, I want to palpate your sinuses. So do you feel any pain or tenderness here?
No.
What about right here?
No.
Okay, perfect. No pain or tenderness noted on sinus palpation. Next, I'm going to look at your nose. Nose, you can put your glasses back on, by the way. Nose is even, symmetrical. Can you tilt your head back for me? Septum does not have any deviation. I'm going to shine a light in there just to look. Fine hairs present, no obstructions. Going to do the sniff test real quick. Can you close one nostril and breathe in? Go. Perfect. And the other side. Perfect. Nasals are patent. I'm going to look at your lips. Lips are dry, intact. I'm going to use my other scope for this one. Okay. Can you open your mouth for me? Smile. Just looking at your teeth. Dentition looks good. No cavities, erosions, all teeth intact. All right, open your mouth up again. Tongue is moist, pink, and rigid. Going to use this popsicle stick, opposite end. Can you say ah for me?
Ah.
Okay, perfect. Uvula rises and falls on phonation. Lift your tongue up. No lesions on the soft and hard palate. Tonsils are 1+, and pharynx is pink and moist. No lesions noted. The next thing that I would like to do is look at your ears. So I'm going to palpate them first. Any pain or tenderness with that? Perfect. And this side?
Nope.
Any pain or tenderness?
Nothing.
Perfect. Okay. I'm going to look in your ear. The way I'm going to do this, I'm going to pull the auricle up and back, and then I'm going to have my otoscope at the best angle pointed towards the nose. Does that feel okay?
Yes.
Okay. Tympanic membrane is pearly gray. Cone of light is present. Just some fine hairs and mouth cerumen present. And the other side. Up and out towards the nose. Does that feel okay?
Yep.
Okay. Tympanic membrane is pearly gray. Cone of light reflex present. Mild cerumen and fine hairs present. Okay. I'm going to get a sip of water real quick. All right. Next part of the exam, I'm going to look at your neck. Oh, I'm sorry. Actually, before we proceed to that, I do need to do a whisper test. What I'm going to do is I'm going to say 3 words, and I want you to repeat them back to me, and I'm going to whisper them. Okay. Basketball, baseball,
basketball, baseball, volleyball.
Perfect. Tree, plant, flower.
Tree, plant, flower.
Perfect. All right. Next, I'm going to do your neck. Look at your neck. So if you can kind of look up for me, I'm just going to inspect it. Color is evenly distributed. Temperature is evenly distributed. There is some neck facial hair present. I'm just going to palpate your trachea. Trachea is midline, no deviations, no masses. We're going to do a swallow test. I'm going to have you swallow a drink of water. While you do that, I'm going to have your thyroid. So if you give me just a second, you can go on and swallow it. Look up just a little bit. Okay, go ahead and swallow. Perfect. Thyroid is palpable. All right, and then I'm going to palpate your carotid arteries. All right, left carotid artery is palpable, 2+ regular smooth rate. Okay, right carotid arteries, 2+ palpable, regular smooth rate. Now I'm just gonna listen to your carotids and assess for any bruits. No breweries present. Bilateral carotid arteries. Next thing I'm going to do is I'm going to feel for your lymph nodes. I'm just going to palpate all throughout, okay?
Mm-hmm.
So I've got the pre-auricle, the post-auricle, occipital, tonsillar, submandibular, submental, cervical, the posterior auricle, deep auricle, supraclavicular. Any pain or tenderness with any of that? Okay.
No.
The next thing I'm going to do is I'm going to look at your arms real quick. Just going to touch them, feel for warmth, even color, hairs evenly distributed, a couple of tattoos noted on the left forearm and left medial upper arm. Colors even, temperatures evenly distributed, no bruises or lesions noted. If you can just see your hands, nail beds are at 160 degrees. I'm just going to check your cap refill. Okay, cap refill lesson 3 on all fingers. I'm going to feel your radial pulses. Radial pulses, 2+ amplitude, regular rate, smooth. Same with your brachials. Brachial pulses, 2+ amplitude, regular rate, and smooth. Okay, perfect. So the next part of this exam, I'm going to have you lay back onto the bed. Let me kick your shoes off. Okay. Actually, yes, I'll do your, actually, yes, I would like to do your posterior exam first. I apologize. I'm actually gonna have you stand up, and if you can step over here, and then I'm just going to have you sit right here with your back facing towards me. I apologize for that.
You're fine.
First, I'm just